We do have a few clarifying questions. Lawal Abyssinola, I hope I pronounced it reasonably correctly, wants to know how can we ensure data security in public health data?
That is a magical question that requires the integration of our national security knowledge, our technology platforms, and frankly, a public discussion of what constitutes acceptable risk and acceptable security. I believe very much that we are moving to a distributed model of data, so we will not have the large data bank in the future. We recognize, though, that public health data generated for public health interventions and public health data necessary for research are slightly different activities. And in order to do an intervention such as the studies recently launched at NIH to look at community-wide testing interventions and the impact on community spread may lead us to a different kind of data output that needs a different level of security than a clinical trial involving a new experimental drug. So we have to recognize the study motivation, the nature of the data, and the acceptable risk to the participants as well as to the institutions.
Tobin Magel asks, how will you encourage universities to incentivize data sharing through things like promotion and tenure?
The conversational strategies that are necessary to do that have already begun. The culture shift of moving towards team science models to understanding science as a social good and to evaluate the balancing of intellectual property rights and expansion of the knowledge base of a country will require continuing conversations. Institutions have financial investments in the intellectual property of their faculty members and their researchers, and the conversation internally about return of rewards to individuals also must be going on concurrently with the stimulation that could be provided. We believe that making the pathways easier to share will go a long way, but they won't change the sociology alone.
And can I add to that, Patty? I mean, on another level, and I think NLM is a real leader here as well, is being able to find the data, cite the data, and give people credit for the data, right? And so, and NLM has done a real beautiful job in here, and we continue to work on DOIs and other things which allow people to obtain credit for what they do and track it in a way that can influence those kind of decisions in the community.
Absolutely.
Tobin Magel and Anonymous want to know how NIH will decide the resources available, particularly for grants that are restricted in terms of their budgets for these activities.
So NIH is examining several different strategies for this, and some of those in the audience may actually have more information about some of the areas than I do. But one of the things we are evaluating is to what extent should data management and sharing costs be a direct cost on a project. Should they be an infrastructure or an indirect cost that an institution becomes responsible for? Or should NIH be setting up resources and utilities that allow the efficiencies that come from large scale activities? As you can well imagine, there are many conversations that have to do with the policy, the responsibility, and the rights of access to information in support of research. But I believe we'll be seeing a suite of solutions that include individual level, institution level, and NIH levels investments.
And just to add on, part of the policy that we worked on has been the supplemental information to try to help researchers understand when data management sharing might be direct versus indirect costs. But I think these are conversations as well over the next few days to really work through to help researchers understand how to submit these requests. And again, the beauty of a prospective plan to think about what you're going to do in advance and then ask for those kind of budgetary needs in your request.
Anonymous asks, how will NIH coordinate with the European Union General Data Protection Regulations?
We have many pathways for coordination, and we recognize that there are different country level and region level differences in data access and data reuse policies. Some of those we deal directly by having reflectors in Europe of specific data elements. and projects. Others, I think, Richard, remain to be really explored and more as we move towards more international or boundary-less studies, where the consent forms must be responsive to local requirements and still allow for perspectives that may not be completely aligned across the world.
Okay, thank you. There are a few more questions, but I think as I read them, they will be answered over the course of this meeting. We need to move on in order to keep.
Thank you very much.